Alfonso Cahero, A Journey into Finance History, Chapter 86. Rise of Telehealth and Digital Health Services, 2020s. Pandemic accelerates the adoption of remote healthcare. In the heart of New York City, amidst the hustle and bustle of everyday life, a silent revolution was brewing in the realm of healthcare. It was the early 2020s, and the world was facing an unprecedented crisis, a global pandemic that would forever alter the course of history. As the virus spread its tentacles across continents, fear and uncertainty gripped the populace, and the traditional healthcare system found itself struggling to cope with the overwhelming demand for services. Hospitals were inundated with patients, healthcare workers were pushed to their limits, and people were hesitant to leave the safety of their homes. In the face of such adversity, a beacon of hope emerged: telehealth. What was once a niche service reserved for a select few suddenly found itself thrust into the spotlight as people turned to their computers and smartphones for medical advice and support. As the pandemic raged on, hospitals became battlegrounds, and healthcare workers fought tirelessly on the front lines to save lives. But despite their best efforts, the traditional healthcare system began to buckle under the weight of the crisis. In-person appointments became increasingly risky, and patients were left wondering how they would access the care they so desperately needed. Amidst the chaos, telehealth emerged as a lifeline for millions. Video calls replaced crowded waiting rooms, and digital prescriptions became the new norm. Doctors and patients alike embraced this new way of delivering and receiving care, recognizing its potential to revolutionize the healthcare industry as we knew it. Telehealth, once seen as a novelty, quickly became an essential tool in the fight against the pandemic. What had once been viewed as an inconvenience, scheduling appointments, traveling to the doctor's office, sitting in crowded waiting rooms, was now seen as unnecessary risk. People were eager to embrace the convenience and accessibility of telehealth, and the industry experienced unprecedented growth as a result. Doctors, too, began to recognize the benefits of telehealth. No longer constrained by the physical limitations of their offices, they could reach patients wherever they were, whenever they needed care. And patients, freed from the constraints of geography and time, found themselves empowered to take control of their health in ways they never thought possible. But the rise of telehealth was not without its challenges. Many people, especially those in rural areas or without access to reliable internet connections, struggled to access the necessary technology. There were also concerns about privacy and security, as sensitive medical information was transmitted over the internet. In response, policymakers and industry leaders worked tirelessly to address these barriers and ensure that telehealth was accessible to all. Funding was allocated for infrastructure improvements, regulations were updated to accommodate remote care, and new technologies were developed to safeguard patient data. As the pandemic continued to wreak havoc around the world, a digital revolution was underway in the healthcare industry. Telehealth was just the beginning. New innovations emerged almost daily, promising to transform the way care was delivered and received. Wearable devices that monitored vital signs in real time, AI-powered chatbots that provided instant medical advice, and virtual reality simulations that allowed doctors to perform surgeries from thousands of miles away. The possibilities seemed endless, and as the world grew more comfortable with remote healthcare, these innovations began to gain traction, paving the way for a new era of medicine. Perhaps the most significant impact of the pandemic was the shift in perspective it brought about regarding health and wellness. No longer was it something to be taken for granted. It was precious, fragile, something to be protected at all costs. And telehealth, with its convenience and accessibility, became an integral part of that equation. Gone were the days of ignoring symptoms, putting off checkups, or skipping medications. People began to prioritize their health like never before, recognizing that prevention and early intervention were the keys to staying healthy. And telehealth, with its ability to connect patients with healthcare providers from the comfort of their own homes, played a crucial role in this newfound focus on wellness. But telehealth was just the tip of the iceberg. As the pandemic accelerated the adoption of remote healthcare, new innovations began to emerge, promising to revolutionize the industry in ways previously unimaginable. wearable devices equipped with biosensors that monitored everything from heart rate to blood sugar levels, allowing patients to track their health in real time and alerting doctors to potential issues before they became serious. AI-powered chatbots that could diagnose common ailments, provide personalized treatment recommendations, and even schedule appointments with healthcare providers. And virtual reality simulations that allowed medical students to practice procedures in a safe and controlled environment without the need for expensive equipment or supervision. Of course, the road to widespread adoption was not without its challenges. Regulatory hurdles, reimbursement issues, and the ever-present threat of cybersecurity breaches all threatened to derail the telehealth revolution. But with each challenge, the industry adapted and grew stronger, finding innovative solutions to overcome obstacles and ensure that telehealth remained accessible to all. Policymakers worked tirelessly to update regulations and expand reimbursement policies, allowing more people to access telehealth services regardless of their location or insurance status. Healthcare providers invested in new technologies and training programs to ensure that they were equipped to deliver high-quality care remotely. And patients embraced telehealth as a convenient and effective alternative to traditional healthcare, advocating for policies and programs that would expand access to remote care for all. One of the most significant impacts of telehealth was its ability to bridge the gap between urban and rural healthcare. For too long, residents of rural communities had been underserved and overlooked, with limited access to healthcare providers and services. But telehealth changed all that, connecting patients in remote areas with doctors and specialists from around the world. No longer were patients in rural communities forced to travel long distances to see a doctor or specialist. Now they could access the care they needed from the comfort of their own homes. And with the rise of telehealth, rural hospitals and clinics saw a surge in demand for services, as patients who had previously gone without care now had access to a wide range of specialists and treatment options. As the pandemic began to wane and life slowly returned to normal, one thing became clear: telehealth was here to stay. What had once been viewed as a temporary solution to an unprecedented crisis had now become an integral part of the healthcare landscape, offering patients and providers alike a convenient, accessible, and cost-effective alternative to traditional healthcare. But the future of telehealth was not without its challenges. As the industry continued to evolve and grow, policymakers would need to work to ensure that telehealth remained accessible to all, regardless of income, location, or insurance status. Healthcare providers would need to invest in training and technology to ensure that they were equipped to deliver high-quality care remotely. And patients would need to advocate for policies and programs that would expand access to telehealth services for all. But despite these challenges, the future of telehealth looked bright. With continued innovation and investment, telehealth had the potential to revolutionize the healthcare industry, improving access to care, reducing costs, and ultimately, saving lives. While the rise of telehealth had been most pronounced in the United States, its impact was felt far beyond its borders. Around the globe, countries faced similar challenges during the pandemic, and many turned to telehealth as a solution. In Europe, where healthcare systems were already strained, telehealth offered a way to alleviate some of the pressure on hospitals and clinics. Countries like the United Kingdom, France, and Germany rapidly expanded telehealth services, investing in infrastructure and technology to ensure that patients could access care remotely. In Asia, where densely populated cities and limited resources posed unique challenges, telehealth emerged as a lifeline for millions. Countries like China, India, and Japan embraced telehealth as a way to reach underserved populations and provide care to those who needed it most. Even in developing countries in Africa and Latin America, where access to healthcare was already limited, telehealth offered a glimmer of hope. Non-profit organizations and government agencies worked to expand telehealth services to remote areas, connecting patients with doctors and specialists from around the world. One of the most significant developments to emerge from the rise of telehealth was a new era of collaboration between healthcare providers, technology companies, and policymakers. Recognizing the potential of telehealth to transform the healthcare industry, stakeholders from all sectors came together to support its growth and expansion.